What is frontotemporal dementia? Frontotemporal dementia is an uncommon type of dementia involving the progressive degeneration of the brain's frontal and temporal lobes. Brain MRI of a 65-year-old woman with frontotemporal dementia. Cortical and white matter atrophy of the frontal lobes is clear in all images. Frontotemporal dementia is a type of early-onset dementia characterized by prominent behavioral changes. These can include disinhibition, socially inappropriate behavior, for example, cursing at coworkers; apathy, loss of empathy, the loss of interest in activities and/or impaired social relationships, for example, indifference toward being verbally abusive; hyperorality, changes in diet, often with a preference for sweets. More severe manifestations include binge eating, for example, eating 2 boxes of cookies per day or consuming inedible objects. Compulsive behaviors may include simple, for example, repetitive speech or motions, or complex, for example, hoarding, following a new religion behaviors. Frontotemporal dementia is characterized by degeneration of the prefrontal cortex, progressing to include the anterior temporal lobes. Neuropathologic features often overlap with other neurodegenerative conditions and may include aggregations of phosphorylated tau protein. Tau is a protein associated with neuronal microtubules, and it normally takes part in microtubule stabilization. In patients with frontotemporal dementia, tau becomes hyperphosphorylated and disassociates from the microtubules, which may lead to instability and disrupted axonal transport. Phosphorylated tau aggregates to form inclusions that can appear as neurofibrillary tangles similar to those seen in Alzheimer's disease, or round inclusions, that is, pick bodies. Abnormal TDP-43 protein inclusions. TDP-43 is a protein involved in DNA repair and transcription, and it becomes abnormally ubiquitinated in frontotemporal dementia. Pathologic TD43 is also found in patients with amyotrophic lateral sclerosis. Comparison of frontotemporal dementia and Alzheimer's disease. Macroscopic examination of frontotemporal dementia is pronounced atrophy of frontal and temporal lobes. Macroscopic examination of Alzheimer's disease is mild to moderate generalized brain atrophy. The onset of frontotemporal dementia is early, between 50s and 60s. The onset of Alzheimer's disease is between 60s and 70s or older. Microscopic features of frontotemporal dementia are initial neuronal loss in the frontotemporal lobes, tau protein inclusions, for example, neurofibrillary tangles, pick bodies, and TDP-43 protein inclusions. Microscopic features of Alzheimer's disease are initial neuronal loss in parietal and temporal lobes, neurofibrillary tangles with tau protein and amyloid plaque. Initial symptoms of frontotemporal dementia are personality and behavioral changes, for example, apathy, socially inappropriate behavior. Initial symptom of Alzheimer's disease include prominent memory impairment. Genetic basis of frontotemporal dementia: autosomal dominant inheritance in 20 to 40% of cases. Genetic basis of Alzheimer's disease includes overexpression of the amyloid precursor protein gene on chromosome 21 and apolipoprotein E4 association. Cytoplasm inclusions with alpha-synuclein are characteristic of dementia with Lewy bodies, which is characterized by visual hallucinations, Parkinsonism, cognitive fluctuations, and REM sleep behavior disorder. Cytosolic vacuolation of neuron and glia with prion inclusions are seen in patients with Creutzfeldt-Jakob disease, a prion disease. So although behavioral changes are common, dementia is rapidly progressive and associated with myoclonus and/or seizures. Presenilin is a component of the gamma secretase complex, which is involved in cleavage of the amyloid precursor protein. Abnormal cleavage of amyloid precursor protein leads to increased beta amyloid deposition that is commonly seen in patients with Alzheimer's dementia. Alzheimer's dementia commonly presents with early and prominent memory impairment with language deficits and spatial disorientation. Although personality changes can occur, they typically present later in the disease process. A frontotemporal dementia presents with early personality change, executive dysfunction, compulsivity, and hyperorality. Neuropathology findings include neurofibrillary tangles due to abnormal tau proteins, also seen in Alzheimer's dementia, and pathologically ubiquitinated TDP-43, also seen in amyotrophic lateral sclerosis.